who's joining us on the discussion as well, senior consultant gastroenterologist and deputy medical director of the Sunrise Group of Hospitals in Kochi. Dr. Jayadev, our focus has been on the health ministry now flagging as many as 40,000 breakthrough infections in Kerala and asking for a lot of these infection samples now to be sent for genome sequencing as well. Now, we were just talking about whether this is in fact the Delta variant resurfacing again in a sense, and that's what is causing the breakthroughs as they have been in many other countries in the world and already flagged for doing so, or is there something more that we need to worry about?
Yes, I will explain what breakthrough infections are for our viewers in just 1 minute. Anyone who has received 2 doses, if you wait 2 weeks, infection that occurs 2 weeks after the second dose is called a breakthrough infection.
Right.
Now, I saw the media report on 40,000 cases, but I'm not sure if 40,000 being the numerator, what the denominator is. Are we talking about first dose vaccinated or second dose vaccinated?
Well, we have now, some data from a single district in Kerala, which is Patnamthitta, and there it appears as though 15,000 patients who have received 1 dose of the vaccine have been infected, and about 5,000 who have received both doses are infected. That is just, as far as Patnamthitta is concerned, we are still to get information about the other 20,000 odd cases.
Yes. And as I mentioned, for the number you mentioned, I've done both calculations for you.
Right.
So if you look at the 40,000 that you initially mentioned, if you assume it is the second dose, if you assume that it is a well-defined, what is called a breakthrough infection after second dose, then the percentage is 0.6%.
Right.
And if we take all comers, that is all the people who received at least 1 dose, then it is 0.25%.
Right.
Now, if you see the published data on reinfections in India, breakthrough infections in India, these are primarily among frontline workers and healthcare workers who are heavily exposed to this virus in their everyday life by virtue of their profession. Now, in their series, you will see ranges of around 8 to 12%. The Vellore series is around 10%. That is, CMC Vellore is the largest trial that I can see. So the reinfection rate is, in fact, quite high. In fact, disappointingly high for all vaccines all around the world. The news is coming in from Indonesia with huge numbers of healthcare workers turning positive. They're not getting sick, but they're turning positive. And vaccination camps in Indonesia had to be closed down, the mass vaccination camps. You saw that in the news. The same sort of news is coming in from the US with plenty of healthcare workers and others coming down with healthcare infections. And we, in our regular meetings with our doctors, we monitor the situation, and we are seeing exactly the same situation here on the ground. Not only healthcare workers, but regular people as well coming down with breakthrough infection. But I must also emphasize that for a numerator, what is more important is what the denominator is. If the denominator is very large, then the percentage is lower. So the percentages based on our discussion here will be a little up or below 1%. So it is not hugely alarming, and it is not out of line with published data. Now, for the non-medically adept individual who is watching the show, all I can say is coronaviruses tend to jump through vaccination. They do cause infection in the nose and throat, but very few of them, in fact, develop severe infections. Yes, there are cases of severe infections, as Dr. Mehta mentioned. People who are really old and frail, people who have severe diabetes, yes, some of them are coming down with severe breakthrough infections as well, but those are a tiny number. Vaccines do work. For the most part, they prevent severe disease, and that is the most important part of vaccination.
Dr. Mehta, quick last word from you. So mask up, mask up, mask up. Even if you've